Hello, welcome to the COPD annual review presentation. My name is Nicola Peltel, Community Matron with Darnall District Nursing Team. Why do we do the COPD reviews? For the QOF, obviously the GPs get paid. For ongoing monitoring of the patient's condition and for recognising changes and deterioration in the patient's respiratory function. So common diagnoses that you will come across when you're doing these, obviously there's COPD, which incorporates chronic bronchitis and emphysema, which is essentially narrowed airways. Bronchiectasis is where the airways become widened and they have real excess sputum production. And pulmonary fibrosis, where the lung tissue is scarred, damaged and really stiff. Very quick recap on what type 1 and type 2 respiratory failure is. So type 1 is a failure of oxygenation. So they have low oxygen but they have normal carbon dioxide. Normal causes pneumonia, COPD, pulmonary fibrosis, asthma, pneumothorax, a PE or pulmonary hypertension. Then the type 2 respiratory failure is the respiratory drive failure. So they have low oxygen levels and a high carbon dioxide. Causes again COPD, could be a CNS injury. There's neuro causes like myasthenia gravis, chest deformities, obesity hyperventilation syndrome. Generally these patients that are type 2s will have an alert card because it's really important that they're not given high doses of oxygen when they have low oxygen levels. So you'll see this, the MRC scale for assessing severity of breathlessness. It's quite an important feature of the COPD review. So these are the 5 levels. I would say the majority of our patients are at least a level 3, if not a 4 or a 5. I find the 2 most important questions to ask patients are how far can you walk before you need to rest? You know, how far can they go before they're really out of breath? Can they get to the toilet? Can they get to the bedroom? Or do they need to rest after literally a matter of a few yards? And do you get breathless when you're getting dressed? If they get out of breath getting dressed and find that it's a long process and they have to pace themselves, I'd automatically score them as a level 5. And important thing to note, is it worse than the previous score? And does that need escalating? Does that need further investigation? Any patients who score 3 and above should be referred or at least offered pulmonary rehab. The referral paperwork is on the template on System 1. It's a standard SPA referral. It's quite straightforward to fill in. I'm happy to help anybody who is struggling or has any questions about it, but we really should be offering pulmonary rehab to most of our patients. So exacerbations. So ask them how many they've had in the last sort of 12 months. Did they have any treatment for it? Did they need antibiotics or steroids or just steroids? Have they had any admissions in the last 12 months? And when they went in, did they need to have IV antibiotics and how long were they in for? So are they aware of the signs and symptoms of an exacerbation? What you will find sometimes is patients will have been admitted, but they didn't need IVs, and potentially if we could have intervened a bit sooner, we could have avoided the admission. So it's important that every patient has this self-management plan so that they can be aware of the signs and symptoms, the really early ones when they're exacerbating. If they don't have one or don't know what one is, task your community matron to help set them one up. Do they have any standby rescue medication? If they do, it's usually amoxicillin and prednisolone. It is not a suitable thing for absolutely everybody. People need to be sensible enough that they're aware of the signs and symptoms and can start taking them appropriately. Any patient who's had more than 2 exacerbations in 6 months or an admission to hospital, refer to the community patient for review. It could be that there's a worsening of the condition. It could be that there is some extra education we can provide to patients, or just tweaking sort of their inhalers to try and avoid further admissions. Also, just to mention the CAT score, please fill it out. It is a useful tool to compare it to a previous one to see if it has increased. And if it has increased, we want to be asking why. So task your community matron to look into that. Final thing I want to mention is inhalers. Inhaler technique is really, really important. At each COPD review, we need to be going over the inhaler technique. I've included links to all the videos for the different types of inhalers. I will pop those links in the description on the video so that you can click on them and you can just have a look and refresh your knowledge on how to sort of go through inhaler technique with patients. Any concerns regarding the technique, task community. And any questions, please feel free to email me. Thank you for listening.